Welcome back to Voices in Health and Wellness. This is the podcast where we spotlight the innovators, disruptors, and frontline visionaries shaping the future of patient-centered care. Today's guest is someone whose work sits right at the intersection of transformation and prevention. Anthony Masiello, co-founder of Lifestyle Telemedicine. Anthony's journey is deeply personal. After a number of health challenges, he went on to co-create a practice that helps others to help themselves under the guidance of board-certified physicians. Anthony, welcome to the show. Thank you so much for joining us today.
Yeah, thanks so much for having me. I'm really happy to be here.
Thank you. So I know you've shared your personal health transformation in other interviews, and it's incredibly inspiring, but could you perhaps walk us through that journey and how it led you to founding Lifestyle Telemedicine?
Yeah, well, I'll start at the very beginning. I first accidentally became interested in healthcare. I went to school for computer science in the early 90s, and I accidentally landed my first job at the National Institutes of Health working on the Human Genome Project. And they really, they hired me for my ability to do web and database programming because they needed to share this genetic information that was being sequenced all around the world. But what happened was I got to work with some of these incredible scientists who were contributing to this project that was like so much bigger than themselves. And that was really new to me. And I quickly, developed that passion myself for not only wanting to work to earn a living, but also to work to contribute towards something bigger. And in that case, it was basically expanding the body of scientific knowledge around genetics and genomics with the intention that in the future that would lead towards better human health. That was something I could really kind of get my mind around and was proud to work on. A few years after, just shortly after the sequencing of the human genome was completed in 2002, my wife decided it was time to move back to New Jersey. We were living in the DC area at the time. And I used that as an opportunity to transfer my career into pharmaceutical research. Because they were caring about genetics and genomics, so they needed my database skills. But for me, I thought this was another opportunity to step even closer towards helping real people. Because now, instead of expanding the scientific body of knowledge so that others could build on this, now I was working for a company who was actually developing therapies that were going to help people directly, that was going to really improve lives. And I felt, it just made me feel great about going to work and working hard every day, and proud to talk to people about the work I was doing. The reality kind of hit me in the face while I was there. My wife and I were starting a family, and I applied for a 20-year term life insurance policy at age 33. It was really kind of a formality. It was like kind of what you did. As you're starting to have kids, you get some life insurance so that if something happens to you as the financial provider for the family can take care of themselves. But what I wasn't prepared for was to be denied. The insurance company took all of my health records and all of my information. And, I know how data works. So they plugged it all into their systems. And it came back that I was essentially uninsurable, which to me, I took as a death sentence, meaning that they did not expect me to live for another 20 years. So here I am professionally, feeling proud about helping other people to, deal with diseases and medical conditions through my work at Novartis. And then realizing that I wasn't very healthy myself and I didn't know what to do. So it took me a little while to process that. I did a lot of reflecting and took an objective look at what my life was like. The reason the biggest reasons for my denial was I was morbidly obese. I weighed over 360 pounds. I had a 54-inch waist. My BMI, I think, was 45 or so. So way off the charts. Those charts come in 2 pages, and I had to go to the second page pretty far down on the other side. I had sleep apnea. I dealt with migraine headaches. I was on medication for high blood pressure. I had eczema on my fingers. I had psoriasis on the back of my neck. And, later I'm learning, this is years after, that, these are autoimmune conditions. These are cardiovascular conditions. These are metabolic conditions. These are all of these problems. And I just seemed to have this perfect storm that led this insurance company to think that I wasn't going to be around for very long. I am proud to say, a little bit of a spoiler alert, I was denied that insurance policy in October of 2005. So here we are, November 2025, and I have successfully beat them, right? Like I outlived the predictions. And really, the unfortunate part is that not much of that credit for me doing so goes back to the conventional medical system. What I had to actually do was step out of that medical system that I was so proud to be working in order to get myself healthy so that I could essentially survive.
That's really, really interesting. It's amazing how many people I've talked to on these interviews that have had a personal health journey that has really kind of steered the direction of their travel and their career. So from that point of, your personal health journey and improving your health, how has that led you to create Lifestyle Telemedicine, and what does that platform look like now, or that organization?
Okay, yeah. So what I did was I basically made a series of lifestyle changes. And those changes, including, eating a whole food plant-based diet, that was my first change. And that was a drastic change for me. And that led me to lose about 90 pounds in my first year. Then I started to incorporate exercise. And I just make that distinction because I think it's helpful for some people to know that the diet change was really the biggest factor for me in my journey. And then the exercise, I think, was really helpful in the second half of my weight loss, in losing my, the remainder of the 160 pounds that I had lost. But it's also, exercise has now been critical in the maintenance of that for over the past 20 years. So that, what that kind of equates to in modern terms is I use lifestyle medicine, which lifestyle medicine is the kind of carefully planned or prescribed use of lifestyle changes to improve health and health outcomes. So I did that for myself. I was still working in pharmaceutical research for years, but as I would walk around our campus that was here in New Jersey, it's 500-acre campus. We had 10,000 people just working on this site, 120,000 people working around the world. And I just couldn't help but think that a large portion of the work that we were doing was to enable people to not have to make the same lifestyle changes that I did. And what I learned through my personal journey is that getting healthy by making lifestyle changes comes with a whole bunch of positive side effects. My confidence went up, my energy levels increased, things that I didn't expect my fingers to, to clear up this eczema that I had been dealing with since I was in elementary school. I didn't expect for the psoriasis to disappear and never come back. I didn't expect for all of these things to happen. I didn't expect to become a runner and someone who enjoyed the outside and exercise and things like that. So I was really passionate about wanting to kind of help people to change their lifestyle to live healthier, because I think that is the shortest path to improving overall quality of life, as well as, the things that we typically measure for someone's health, kind of health assessment. So again, I'm not a doctor, so I did not know. So I wasn't going to change the way I was practicing, because I'm not a practicing physician, but I did start to do some health coaching, and I started thinking that, I can reach a few people by health coaching, but how am I really going to help masses of people? How am I going to help thousands or tens of thousands or hundreds of thousands of people? And while I was immersing myself in the world of lifestyle medicine, I would go to conferences. And I would see the same thing happen over and over and over. Like every single time there's either a physician or a scientist, or sometimes a physician scientist who's presenting some data and some information that they've learned, sharing information that they've read in studies about how lifestyle changes impact a particular disease. Sometimes that would be for diabetes, sometimes for heart disease, sometimes for autoimmune, multiple sclerosis, all these conditions. Then they would share patient testimonials, people like myself, or people that they have helped. And they would show real world examples on how what they had just explained impacts people's lives. And then they would go to the Q&A to the audience. And almost every single time, someone from the audience would raise their hand and say, hello, my name is so-and-so. I also suffer from heart disease, type 2 diabetes, autoimmune conditions, whatever the condition was. And they would ask the question, where can I find a doctor who can help me? And there was no good answer to that question. Because doctors who practice this kind of medicine are scattered at best. And even the ones that you can find are not necessarily practicing somewhere where you can go and book an appointment with them. Sometimes they're, they have a wellness center where you have to go and stay for a period of time. Or sometimes they're working in a hospital and they're kind of doing this as something that they're interested in, but more of a niche practice. But you can't actually book an appointment for them. So I started to combine all the puzzle pieces in my mind. I knew a lot of doctors who wanted to practice better medicine. I knew a lot of potential patients who wanted a doctor who would help them to make lifestyle changes to heal. And, I had the kind of IT/computer experience to know that I could confidently build a telemedicine platform where these two groups could meet and interact. And that's what lifestyle telemedicine is. It's a platform for doctors who practice lifestyle medicine. We have 7 doctors right now, and they're licensed to see patients in all 50 US states. And they also provide international consultations for anyone who's outside of the US. The only difference there is, since they're not actually practicing medicine for people outside the US, because they're not plugged in, they won't be able to order labs because they don't, because we're not plugged into the lab systems in all these other countries. And they also cannot prescribe medications for people who are outside of the US. But for people inside the US, the doctors can, they can take over care of many of a patient's health conditions. They can order the testing that's needed. They can prescribe the medications that may or may not be needed. And they can help them to make lifestyle changes to ultimately reduce or eliminate medications when possible, but really start to live healthy and thrive.
Amazing. So thinking about this platform then, so do you get some sense of who you're actually serving? And then how does care typically unfold for a new patient?
Yeah, so who we're serving and who we should be serving may be two different things, right? We started within the niche. We started reaching out to people who already know what lifestyle medicine is. And many people who have tried, the people who initially started working with our doctors are patients who had already been trying on their own. So they've read some books, they've listened to podcasts, they've watched YouTube videos, they've done a lot of their homework, and they've made some significant changes to improve their health, but it hasn't quite worked well enough for them. So then they start to work with one of our doctors who can help them to be a little bit more prescriptive and can take all that general knowledge and information that they've gathered on their own, and they can apply that very individualized, very specifically for that patient, given that patient's medical history, current conditions, even things like preferences and habits and all of that. So the doctors each create individualized plans for every patient that they work with. We do have a couple of assessment packages that help people to understand, their current state of heart disease or metabolic condition, or their heart health, or their metabolic health, or even general health and wellness. But it always leads to a tailored plan that's specific for an individual. And sometimes if that's a healthy person who's working on prevention, someone who's much smarter than I am, who's actually catching this before their health is in the danger zone, then the doctors can help them to make little tweaks to make sure that they don't have issues to deal with down the road. If it's someone who's newly diagnosed with something like type 2 diabetes, the doctors can almost always help them to not need to go on medication or to get off their medication, even if they are newly prescribed. They really work with a wide variety of conditions, but I think the key is that they provide individualized care that focus on a lifestyle first approach to treating any medical conditions that the patient is concerned about.
Thank you. I mean, lifestyle medicine and telehealth are both evolving quickly, and COVID certainly really accelerated the growth of telehealth. What big trends are you seeing right now in the industry that are influencing your work?
I mean, yeah, telehealth feels normal now, which is great because I started this in 2019 before COVID, and I was worried about two things. I was worried that people did not think that telemedicine was a real a way to deliver real medical care. And I was worried that people wouldn't believe that lifestyle medicine is actually an evidence-based scientific approach to treating actual medical conditions. COVID and time have erased the challenges around telehealth. Everyone is used to it. So that's easy. And sometimes people prefer it because a half-hour appointment literally takes about 35 minutes out of a patient's day, right? There's not a lot of traveling and waiting involved, things like that. Lifestyle medicine is still a challenge, helping people to understand. And the challenge is not that it doesn't make sense. Initially people might think that they might put lifestyle medicine into a category of kind of alternative approaches. But when you really get down to it, it's so much more practical and pragmatic than that. It's like, it's not that, broccoli will lower cholesterol or something like that, right? Like, it's not like broccoli is this magic thing or that any one vegetable or something, or specific food type, any kind of food type is going to do something. But what we have to realize is that the reason our health is deteriorating is because of this the stress that we've been putting onto our system for years. In my case, I had 33 years of basically beating myself up. And what really helped me the most was I stopped beating myself up. It's like if you're hitting yourself in the hand with a hammer, right? Sure, you can take medication, you can do all kinds of things to mask the pain. But the first thing you need to start doing is stop hitting yourself with the hammer, which is essentially what lifestyle medicine is in the beginning for most people. So you want to stop doing the things that are causing the damage in the beginning. And sure, then it looks like, these changes healed you, but what you really did was you stopped hurting yourself over time. So lifestyle medicine still has a long way to go for people to really understand it and for people to start seeking lifestyle medicine approaches to treating medical conditions. So we are now stuck in a position where we're trying to both educate and serve at the same time. So if someone is lucky enough to have found us, which we're not very easy to find, and then they're also have confidence enough to book a first appointment, then the doctor starts working with them and has to help them to understand how making some lifestyle changes can actually improve their conditions.
I was going to ask, do most patients come ready for change, or do you still need to do a lot of upfront education? I remember you mentioned about education being one of the pillars of what you do. Yeah. But just in terms of what most patients are showing up ready to commit to, what's it like at the moment?
Most of the patients that find us now are ready to change. And that's partially because we're not doing a great job of marketing. We're hard to find. So by the time someone actually finds us, then it's usually because they've been searching for the type of solution that we offer. What I would love to do is figure out how to reach more of kind of a general audience of people who don't understand that doing things like managing your diet, your exercise, your sleep, your stress, your social connections, and all these things can help you to heal. And then I think the weight of the education will become even more important. because we're finding people who have already read some books or have already listened to some podcasts or have some level of understanding, which is wonderful for the doctors because it's fantastic to get people who are ready to change. But I feel like the real magic to help society and the population at large is going to be to help people who don't even know that they need to make these changes, to help them to understand and then to implement and then to get well.
Interesting. I completely resonate with that because I do functional medicine, which is a massive overlap with lifestyle medicine, and I completely get it. It's raising that awareness for somebody that doesn't necessarily realize they have the problem to get them to come to the table. So I completely get that. I was going to ask you about shifts in patient expectations and also things like insurance coverage or even clinician burnout and how that's affected your business and perhaps your approach to growth.
Yeah. So we have obstacles here in the US. So first of all, the people are not used to paying for medical care. People are used to paying a lot of money for insurance, whether it's through their employer or on their own. And then their insurance is then paying for their care. The problem is that insurance is not yet reimbursing at a rate where a doctor practicing lifestyle medicine can spend the time and do the education and follow up with the patient the way that's to the extent that's necessary to actually help the patient to heal and to change and to get results. So we have to have patients pay out of pocket. So we're asking our patients, and we appreciate our patients every day for stepping outside of the medical system, and they're paying out of pocket for their appointments. Now, the shortest appointment that we have at Lifestyle Telemedicine is 30 minutes. Most new patient appointments are 1 hour, and that's a full hour or that's a full 30 minutes with your doctor. And we're trying to keep that as affordable as possible. You know, the rates are $175 for a 30-minute appointment, and it's exactly double, $350 for a 60-minute appointment. And again, that's all time with the doctor. So if you are in the US and you do have private insurance, after the visit, we provide each patient with what's called a superbill. And that just includes the doctor's information. It includes all the diagnosis codes for the patient, and it includes the treatment codes so patients can submit that to their insurance for reimbursement. And some patients are fully reimbursed, some patients are partially reimbursed, and some are not reimbursed at all. What we find is that patients who have insurance with good out-of-network benefits and they have multiple chronic conditions are getting fully reimbursed for their visits. But if you don't have, if you've not met your deductible or you don't have good out-of-network benefits, and you only have, if you only have 1 or 2 chronic conditions, or you don't have any and you're working on prevention, then your insurance company is likely not going to reimburse the full amount for the appointment.
Got it. Many of the conversations I'm having with people in North America, the insurance thing comes up in every single one. It's a little bit alien to me because we don't really have that situation in the UK because all of this is all of this is out of pocket. But it's interesting that the insurance thing always seems to rear its head in discussions of out of system care, which is interesting.
Well, and it's unfortunate, honestly, but what we've done is I just had a conversation yesterday. We pay people to cut our hair. We pay people to to do all kinds of things for us, to take care of our motor vehicles, to take care of our homes, to take care of our gardens, to do all of these things. We're used to paying for a lot of services. The one that people in the US are not used to paying for is healthcare, which I would argue is the most important thing. And it's probably the most risky thing to outsource to a system that you end up having very little control over. It really does set the patient up to be kind of dependent on, whatever the insurance company wants to provide, for care. So it's a huge problem for us here in the US, especially for people who want better care than is offered from the kind of conventional processes and systems.
Thank you. So this obviously is a business. You're running this as a business. I'm just curious to know what's working really well for you as a business model, which is what telemed, your platform does.
Yeah. So you asked also about the physicians and physician burnout and stuff, and we're so fortunate to have these 7 physicians working for us. But I will add that they are all working part-time, practicing lifestyle medicine. Most of them have other work that they do as well, because they are as passionate about this as you are and as I am, and they're trying to figure out how to make this work. So what works really well is when a patient calls, and they say, "Oh my gosh, I had no idea that I could have a doctor like this to care for me," and that that's a little bit of a kind of a feather in the hat, right? It's like, oh wow, we're providing something that's useful. Or what's most important is when we hear from patients after they've had 1 or 2 or 3 visits with their doctor and they've started to get well, or they've gotten off their medications and they become so proud, and then they start telling other people, about how good they're feeling and how they're off their medications, or how they're no longer diabetic anymore, or they no longer have high cholesterol and they don't have to take pills every day, and those kinds of things. From a business, from actually on the business side and purely on the financial side, it's still challenging. The doctors are not paid what they should be paid. The company doesn't make what it should be making. And there are periods of time where I am able to pay myself a very modest salary. And then there are long periods of time where I'm not able to pay myself. So it's really, truly, everyone is flying on passion. And I share that because I would guess that there are others who are in similar situations. But in the big picture, it also makes these movements fragile, right? If they can't financially sustain themselves, and if we can't have a physician making a good living practicing lifestyle medicine, then how long are they going to be able to continue? Or if we can't have administrators, making a fair wage for their work, how long are they going to be able to continue? We went through a period of 3 years where we were partnered up with another company, and we weren't really focused on growing the business. And we had 6 of our doctors left. When we joined that company, we had 11 doctors. We had 6 leave while we were there. And now since we've separated, we've had other doctors join us again. But the sad part to me is that none of those 6 doctors went on to practice lifestyle medicine. They all left to go back into conventional medicine because they needed to work at a job where they could, kind of make some more money or make a better living for themselves. And I just have the utmost respect for these physicians who are doing this on top of their other work, because it's not easy to become a doctor, right? I mean, never mind all the education and the schooling and the time and the investment that you have to do up front, and then paying back loans over periods of time. But then the amount of responsibility that a physician takes on in caring for a patient, it's incredible that they're willing to do this kind of work. And if I can do anything to help them to become more fairly compensated for that, taking a lifestyle medicine approach, then that's something that's a contribution that I would be proud to make if I can help to figure that out.
Thank you. And on the flip side, what's the sort of most frustrating or complex part of growing lifestyle telemedicine from your perspective?
I would say it's marketing. Mm-hmm. It's competing with all the noise that's out there. For better or worse, I think we have one of the most honest transactions in healthcare. A patient pays a doctor $175. The doctor is focused 100% on that patient for that half hour of time and helping that patient. We don't have any behind the scenes pills or procedures or anything that we're trying to encourage that patient to take on. And so as honest as it is, we don't have anything flashy to lure people in with. We don't have a short promise. We don't say, we can't go out there in the marketing world and say, hey, we have this special tea, and if you drink this tea, all your health problems will go away. Or, we don't, but we have to compete with that. But we don't have that. We don't have anything that's kind of simple. And I think it's part of the positives and the negatives. The approach is so individualized that it's hard for us to package it in a way that people can really understand it until they experience it. And that's really challenging.
And if you had a magic wand and you could fix one thing in the business tomorrow, what would that be? I mean, perhaps marketing aside, because I think you mentioned that. Is there anything else that you would love to be able to just kind of solve overnight with a magic wand?
I would love for the insurance companies in the US to reimburse for these services. If we could take away the pay out of pocket part, I think we could get a lot more people help. And I do think that it would lower the overall cost on the medical system. If we get people off these medications, if we create that environment in the body where the body starts to heal and doesn't become dependent on medical pills and procedures to live for a long time, I think it will save money overall. And we need the insurance companies to believe that people will do it, that patients will do it, and start to invest in that kind of prevention rather than waiting until people have problems and become dependent on unconventional medical care.
Obviously, you're looking to grow, and I know you want to reach more people, but if you had a sudden influx of new patients next week, would anything break? Hopefully not you and your colleagues.
No, honestly, it would not. We are approached. I have a folder on my computer with, I think, 123 CVs from doctors who would love to collaborate with us and would love to see more patients. I have the upfront conversation with them, with anyone who's interested, to let them know that this is a place to come and to build your practice. We don't have a lineup of patients waiting to see doctors. If we did that, if we had that lineup of patients, we could very easily bring on enough doctors to scale seamlessly. I don't think anything would break. And we didn't build the technology ourselves. We're using industry standard technology, with our electronic health record systems, our patient portals, all of that stuff. So I have confidence that can scale very easily.
So where do you fit into the platform at the moment in terms of where you're spending your time? Is that more sort of clinical, operational, administration, all of the above, none of the above? Where do you kind of fit into this?
It's mostly operational and administrative. I feel lucky now sometimes when I get to do help the patients. We have a full-time patient care coordinator. Her name is Susan, and she takes amazing care of the patients outside of their medical care, right? But when patients need to get onto the portal or they have questions about which doctor to see. But when Susan takes off, I answer the phones, and it's one of my favorite things to do is talk to people who call up on the phone or who are interested or want to learn more about what these doctors do and how it might help them. So that's fun, and I get to do a little bit of that. But mostly I'm working on the business stuff, trying to figure out the accounting and the numbers and keep everything afloat, keep everyone else and all the other, the other expenses paid, and then really focused on what can I do to help these doctors to see more patients? What can I do to help raise awareness so that more people are aware of these doctors and can come and learn about them and hopefully make an appointment with them.
Thank you. I think scaling physician-led care is tough in any sort of sector, but have you ever explored or thought about things like group programs or any digital tools to try and support patients between consults or your colleagues working with them?
Yes, we've explored. We haven't been able to implement anything like shared medical appointments or group visits. It gets really complicated in the US with the state licensing. In order for a physician to provide care to a patient, the physician must be licensed in the state where the patient is at the time of service. So what that means is if we set up shared medical appointments for, let's say, diabetes, and we had patients participate from 10 different states, and we don't have any one doctor who's licensed in all states. We can provide state, coverage for patients in all states because the doctors kind of divide and conquer. Some of them have 8 licenses, some of them have 10. But if I have 10 people participating and they're each coming from a different state, then we have to have doctors who are licensed in all those states in that shared medical appointment in order to have it count as a medical visit. And then what we have to do is after the appointment, the doctors have to spend a lot of time then charting for each one of those patients outside the visit. So I think it's more efficient in some ways in that the patients get, like they get all the information, they get the benefit of learning from each other's questions, they get the benefit of learning from how the doctors are treating each person while they're all together in that community. I think they get the benefit from the social aspects of spending time together. But on the administrative side, we have not figured out how to make it work efficiently to be able to implement something like that. So what we do is we do live Q&A chats on social media and YouTube, and we do those twice per month so that people who have general questions can come, and it can be existing patients who have questions in between their appointments, or it can be people who are not patients, they're just part of our community, and they can come there and they can ask questions. Obviously, they can't receive medical care, but they can get general questions answered, and they can get pointed to resources and different information that they can read and look up on their own and stuff like that. So we do try to balance. We try to provide enough for people who want to help themselves and who, for whatever reason, cannot book an appointment.
Thinking ahead to the future, what's next in the next 12 months for Lifestyle Telemedicine? Do you have any particular goals or plans for the business?
Our goal is to grow. And one of the most exciting ways that we've been growing recently is we're putting in a number of partnership programs. There's this company called El Nutra, which is, they have this product, this consumer product called Prolon.
Yeah, I'm aware of it.
5-day fast mimicking diet. Yeah, it's very popular and it's fantastic. But they also, what people don't know as much about them is they also have a diabetes remission program where they have RD coaches who will run patients through a course of 6 5-day fast mimicking diets over 6 courses of that over a 6-month period. So once per month. And the RD coaches will help to monitor the patients and support them in between courses of the fast mimicking diet specifically to help them put their diabetes into remission. But El Nutra was running the program in Texas and California because that's where they had doctors who could then do the deprescribing and medication adjustments. But I worked with their chief medical officer, Dr. Will Shu, and we came up with a partnership where our doctors will provide medical care for the patients who were going through their diabetes remission program. So essentially, we helped them to overnight to make their program national. So now instead of only being able to see patients in Texas and California, now they could see patients in all 50 states because the licensed medical care was coming through us. We have a similar arrangement with the McDougall program, which Dr. John McDougall was a very well-known, well-respected, kind of whole food plant-based physician who runs a 12-day program and helps people to eliminate all kinds of diseases during this very intensive 12-day period of time. Dr. McDougall has passed earlier this year, but his daughter is continuing to run the program. And they also wanted doctors who would provide licensed medical care so that they could run the program online virtually for people who weren't coming to California. So we've plugged in our doctors behind that program. And now they can run that program medically supported to patients everywhere. And if someone requires labs or changes in medications, our doctors can handle that part of it while they're going through the health transformation program. And we're also working with a couple of other coaches who are similar. So we can be that back end. We can provide medical supervision or medical support, whatever people want, as long as it's kind of like-minded medicine, lifestyle medicine. Then we can help other people to take their non-medical services and to include a medical component so that they can provide like deeper care for the people who they can reach in their communities.
Brilliant. And finally, what do you wish more people, whether it's patients, doctors, insurers, understood about lifestyle medicine as a model for care?
Yeah, I wish that they understood that it works, that it really, really works. I would love for us to have like a drug commercial, but for lifestyle medicine. We can follow that same pattern that we see on the television all the time. It's like, do you suffer from heart disease or type 2 diabetes or metabolic conditions or autoimmune? Ask your doctor if lifestyle medicine is right for you. Side effects include weight loss, more energy, feeling better, better family life, career advancement, all of these things that come from really taking good care of yourself. I think that would be huge if we can figure out how to reach the world and help them to know that lifestyle medicine, functional medicine, as you said, there's so much overlap between these things, integrative medicine, that these disciplines of medicine are worth pursuing. And I think that they're worth pursuing first, and then using conventional medicine as a backup when it's necessary.
And on that note, Anthony, I'd like to thank you enormously for your time today. It's been really interesting hearing about your personal journey and how you've converted that into something really amazing to help lots of other people restore their health using a lifestyle medicine approach. And thank you very much for sharing that, and also some of the challenges in running this as an operation. I think it's been really interesting and something people can really learn from. So thank you so much for your time.
Yeah, you're very welcome. Thank you so much for having me on. I love that you share these stories out there and these conversations, and I really appreciate being part of it. Thank you.
Thank you.